Hello, everybody. This is our group report on making hospitals accountable for their nonprofit status. We rhetorically asked the question, what would you do with $2 billion? So some background on the motivation for our project. Uh, Hospitals throughout the country claim nonprofit status, but they rarely contribute an equal amount of the revenue they're counting as nonprofit to actual charity work. For example, in California alone in 2010, private so-called nonprofit hospitals gained nearly $2 billion annually in tax relief beyond what they provided to their communities in charity care. So we asked ourselves, what would you do with $2 billion? Here's some historical context to the problem. Early on in the 20th century and before, charity care was really primarily provided by individuals, by religious organizations, and it was not considered something that businesses would provide. In the 1940s, the federal government granted nonprofit status to hospitals that were committed to doing substantial work for indigents, for the poor. But with the passage of the Medicare and Medicaid laws, nonprofit corruption emerged as a serious problem, and nonprofit hospitals began to receive tax exemptions so long as they provided services under incredibly broad definitions. So this would include things like running celebrity golf tournaments that promote the hospital, perhaps garner a small amount of charity donations that are then passed on to the community, publicity campaigns that are done in the name of the hospital, charity balls, all kinds of things that really do not give back to the community. And it goes way beyond that, but we use the golf tournament as kind of an example. So how does this relate to the study of health and wealth inequality? Not-for-profit and nonprofit organizations enjoy tax exemption status, but they really do not contribute adequately to the communities from which they profit. There's no transparency here. There's no way of really telling how this money is spent that's being claimed as nonprofit. So the symptoms of this are many, but one that we focused on is that some of these nonprofit hospitals, for instance, in Missouri, have established a practice of going back and trying to collect money from patients that really should be categorized as charity cases. And they have even gone so far as to garnish the wages of these people. Sometimes this is done through side businesses that are really collection agencies. This is a picture of someone who was in the newspaper who had something like 30% of his wages garnished by a hospital in Missouri. So we didn't know this until we started this project, but the majority of hospitals in the United States now are nonprofit. This graph is showing us that 60% approximately of the hospitals in the US have nonprofit status. So how does this impact the health of our nation? Nonprofit hospitals should assist communities and individuals in need, but they've really become involved in really corrupt practices such as garnishing people's wages to recover revenue when in fact they should be giving charity care to these people. And it, of course, disproportionately affects low-income families and individuals who have no insurance or inadequate insurance, even post-Affordable Care Act. These are people who have few options for care and are really obligated to go to these hospitals. So our solution, we're proposing federal legislation that mandates a standard specific definition for charity care and defines what is considered charity care and disallows these promotional activities that go on by the hospital that really just serve to market the hospital. It requires that 25% of the community budget benefit go to actually building infrastructure that would serve the underserved members of the community. It requires community planning for benefits with a committee comprised of members of the community, somewhat like the old hospital boards for public hospitals. So here are more specifics about the legislation. The first clause is designed to assure accountability and transparency in nonprofit hospitals and the services they provide to communities, with a clear and tangible definition of what constitutes community benefits. It also requires that 90% of community benefits be allocated to clearly offer community services that encourage community health. The second clause establishes federal regulations that tightly control how debt is collected from patients and shields them from wage garnishment and this loan sharking practice that we described earlier. The third clause calls for committees to be established at each hospital that really oversee how this community benefit money is spent and ensure that it is really returned to the community from which it is taken. The fourth clause has stringent penalties for noncompliance, a penalty of 10% of the hospital's gross revenue for the number of years that the hospital's infraction of the law would be required. Late payment penalties would be incurred, and we would go so far as to requiring the top brass at the hospital to actually do community service in the spirit of giving back and returning to the community. So again, what is our vision for $2 billion? Healthy, safe communities that everyone can call home.